Hello, everyone. My name is Onikepe Owolabi. I'm the Senior Global Director for Maternal, Newborn, Child Health and Family Planning at IntraHealth International. Today, I'm excited to be reflecting on my ongoing leadership project called Amplifying the Voice of Female Policy Stakeholders to Catalyze Change in Reproductive Health. Unlike many other domains of health, reproductive health is not treated purely as a public health issue. It is subject to constant contestation arising from questions about gender and equity, human rights, morality, religion, and cultural norms, which carry great symbolic value for governments. Unfortunately, the greatest burden of many poor reproductive outcomes are in sub-Saharan Africa. In 2016, the Good Matter Lancet Commission elaborated an inclusive and ambitious agenda for sexual reproductive health and rights. However, amongst components elaborated on as important for reproductive well-being, only a few topics are prioritized by most development funding and programming at countries and at the global level. These are typically maternal health and access to contraception. An example of an area which is relatively underinvested in and stigmatized is reducing recourse on the impact of unsafe abortions. Unsafe abortions are largely linked to restrictive laws and are thus largely preventable by policy and health system changes, in addition to providing contraception. However, access to comprehensive abortion care, which includes safe abortion within legal boundaries and post-abortion care to manage complications, is not prioritized as a core part of reproductive health by many donors. My project commenced during my time at Vital Strategies and is taking place in Rwanda. Rwanda allows for access to a wide range of comprehensive abortion services within their law and is currently working on scaling up access with multiple partners. Vital Strategies provides technical assistance to the Ministry of Health focused on strengthening local capacity to collect, analyze, and apply routine surveillance data to the development of evidence-based policies. However, working in the policy space to develop these kinds of inclusive, gender-responsive policies can be challenging because very few women are able to participate in the forums where these decisions are proposed and discussed. Although Rwanda is a particularly progressive country with more than 50% of parliament seats held by women, female policymakers in Rwanda and many sub-Saharan Africans are embedded in patriarchal cultures. This constrains their ability to advocate strongly for important issues like reproductive health. The research evidence shows that women's participation in politics advances gender equality. However, usual practice is to appoint women to soft issue portfolios like social affairs, children, and families, and they are poorly represented in critical spaces like health and finance. As part of my project, we're convening a policy accelerator workshop with multiple stakeholders in each country to share the findings of a background data quality assessment, discuss the evidence on comprehensive abortion care in Rwanda, identify implementation gaps, and explore how to advance the Ministry of Health goal of making care more accessible and affordable for women. In the first phase of my project, I sat with colleagues in the US and Rwanda for quite a while to think through the format of a month-long policy accelerator workshop. We focused on how to proposively include a broader group of female stakeholders in this process, how best to open and facilitate an in-person workshop on a very challenging topic that the government is willing to work on but feels personal to most stakeholders, how best to build small in-person groups to go on to collaborate on policy briefs that will be delivered to Ministry of Health. At this point, we have a more inclusive list of participants, female leaders from the ministry, health, legal, and advocacy, NGOs, and CSOs. We will approach discomfort head-on by starting the workshop with a values clarification and attitude transformation session to talk through why reproductive health and unsafe abortions are important but sensitive issues. We're structuring our small groups intentionally so that they're gender balanced with participants from different backgrounds. And during virtual facilitation of the policy brief writing, we will encourage diverse views to be considered and talked through. At the end, we will explore the workshop data to understand participants' experiences and attitudes before and after the VCAT workshop, and the workshop will hold at the end of February. Thereafter, we'll share policy briefs with the Ministry of Health. I'd like to express my heartfelt gratitude to the WomenLift Health community and staff for being part of my journey and growth in the last year. I'm deeply grateful to my friend, Dr. Dana Chukwuma, for nominating me for this opportunity and telling me how life-changing it was for her. I'm also very grateful for my dear managers and sponsors, Dr. Ambidu Coleman and Sharon Kim Gibbons, for supporting my participation, even though I have made many transitions during the program. Thank you very much for listening.